Your Excellencies and representatives of the 75th World Health Assembly, I am pleased to address you today on behalf of Global Citizen, an international advocacy movement working to end extreme poverty. The COVID-19 pandemic has pushed nearly 100 million more people into extreme poverty, and for the first time in 2 decades, the gap between rich and poor countries is widening. The global vaccine rollout has been grossly unequal, with production, ownership, and distribution of vaccines largely concentrated in wealthy countries. While more doses are available now, low and middle income countries are not put in the support to strengthen frayed health systems and get vaccines as well as tests and treatments to people in need. Today, we see many richer nations keen to move on, all but declaring the pandemic is finished. But if world leaders walk away now, we know what will happen. The virus will continue to spread and evolve and leave us all indefinitely facing the threat of a more dangerous variant emerging. And if we walk away, so intent to get back to normal that we learn nothing, the inequities and injustices exposed and exacerbated by the pandemic will live on within a global health architecture that continues to severely lack solidarity, and the world will remain at risk of repeating the same mistakes that led to this catastrophe. To all the nations gathered at this assembly, I urge you to continue taking all possible steps and fully committing the resources needed to defeat COVID-19 and protect everyone, everywhere, and to learn the lessons this pandemic taught us about the importance of preparedness, of public health, and of investment in community resilience. With the right political will, it need not be a choice between fighting one infectious disease versus another, or making one investment over another. The action we take must be carried out in a way that also builds health system capacity and security against future pandemic threats. That is why Global Citizen is grateful for the initial steps underway to develop a pandemic treaty, one which we hope will plainly recognize and remedy the nationalistic behaviors that unnecessarily prolonged this pandemic and caused untold preventable deaths. Indeed, we must strongly promote and incentivize cooperation and put it at the core of pandemic prevention, preparedness, and response. But for any negotiation of an international binding document to succeed, civil society must be duly heard, informed, and consulted with transparency. We are also grateful for the proposals to establish a stand-in peacetime financing mechanism for pandemic preparedness so that we are never caught flat-footed again in the face of an emerging threat, but it must be fully funded. This is something world leaders can immediately budget for right now. And finally, we are grateful for and inspired by the mRNA Technology Transfer Hub. The hub is not only beginning to build precisely the diversified regional manufacturing base for vaccines and medicines that the world needs in a future pandemic, but it's also serving as a model of solidarity and cooperation for the global north. It shows how research and development for medical countermeasures can be conducted by multiple actors across jurisdictions towards collective aims, including via the sharing of intellectual property. And it's building the foundation for a new business model that prioritizes a fair return and public health interests over the pursuit of maximum monopoly profit at all costs, even in terms of human lives. But the hub needs your support to be sustainable, and work should already be undertaken to that end, in coordination with relevant institutions like the World Health Organization, Gavi, and UNICEF. As part of Global Citizen's End Extreme Poverty Now campaign, I urge governments to take these steps. Don't give up on the goal of vaccinating at least 70% of people in every country against COVID-19. Commit the funding needed now to rapidly scale in-country delivery capacity across under-vaccinated parts of the world, and in doing so, ensure that systems are strengthened for the longer term. ensure sustainable vaccine supply and access in low and middle income countries to prevent and protect COVID-19 variants and future pandemic threats. This should include equitable access to next generation vaccines once they become available. This is a key reason why we still need a comprehensive and effective intellectual property waiver at the World Trade Organization. Invest in women and girls' health, including sexual and reproductive health and rights up to and including abortion. This pandemic has affected women and girls harder and deeper across nearly every metric of assessment, putting a generation of young girls at risk across their physical and mental health. Women's agency over their bodies and their life choices, including family planning, continues to be curtailed across too many parts of the world, and the response to COVID-19 has diverted too many resources away from gender-responsive care at a time when it is needed most. As one example, it is disgraceful that each day there continues to be 800 childbirth-related deaths. So we call on you to recommit to women's health and women's rights. It's the right thing to do and the smartest investment. Global Citizen urges you not to forget the cry of millions and the promise of your own governments last year of no one is safe until everyone is safe. As of today, many parts of the world are far away from being able to leave COVID behind, and until that happens, none of us will truly be safe. Global Citizen is here to collaborate with you across our campaign and global events to help bring us closer to that goal. Thank you.